Hello and welcome. I'm really pleased. Today we have Kevel Gumbs, who is the CEO and founder of HOBO Community Hospital, Accra, Ghana. Welcome,
Good
Kevel.
evening. Good evening.
Good.
How are you?
All is well, and greetings for this new year.
Yes, thank you. And Happy New Year to you too.
Thank you. Kevel, tell us about your family background.
So my dad was born in St. Kitts and my mom was born in Montserrat. I was born in Montserrat. Um, I lived in Montserrat until the volcano eruption, which led us to had to evacuate the country. Um, I attended Kinsale Primary School,
Okay.
KPS with the KPS project. I'm one of the writers of the book,
Dr. Shott's
for
project.
Dr. Shott's project. Yes. Um, so we have two books out. So we did the first book in ooh, so long ago when we were children, when we were kids. First book is called Out of the Mouth of Babes.
I have it here.
Cool, cool, cool. And then the second book as one we done recently, from babes to proteges and beyond.
I
So
also
it's
have
just
that book here as well.
yes, yeah, yeah, yeah. Excellent. That's it.
Well done. So you are another KPS protege,
Yes, yes, I
and
am indeed.
excellent. So tell us about Community Hospital, Ghana.
Okay. So we started the project about 3 years ago, um, and we're at a stage now um, where we are looking to launch in the next few months. So in April.
Hmm.
It was a long 3 years.
Yeah.
It wasn't easy, but we made it to the end. So we're about 95% complete, right?
Mhm.
The hospital, because of the area where the hospital is, I want to make the hospital the main hub of the community because
Okay.
the community don't have a hospital nearby. And if
Mhm.
anyone wants to go to a hospital, they have to travel for, you know, 2, 3 hours just to get to the next hospital.
Mhm.
Um, there is a government hospital, sorry, a government clinic there, but it doesn't have the facilities of a hospital, and it's not as updated or modernized
Mhm.
as HOBOR Community Hospital would be, or any other hospital. Yeah. So we would have maternity. We would Our main priority would be in maternity
Mhm.
and women health and antenatal care. We'll also have family planning, a children's ward, medical and surgical department as well. With the surgical department, um, I've done a auxiliary room.
Okay.
So in Ghana, they don't have that many auxiliary rooms. But one of the problems is that students in Ghana who who has to observe procedures,
Mhm.
some might not have that practical experience
Mhm.
to observe procedures.
Mhm.
So one of the things I've done, I've created a auxiliary room where you can have students there and
Excellent.
then observe surgical procedures there.
Mhm.
Um, we do have outpatient and inpatient, about 36 beds
Mhm.
at the moment, laboratory and X-ray and things like that.
Mhm.
We because of because of where the hospital is, we can't have like let's say specialized services there. So let's say heart health or diabetes and things like that. So what we plan to do is have clinics.
Yeah,
So once a week, you might have, let's say on a Monday, you have um, heart health, and then we book appointments, and
mhm,
everyone will come on that day and have that specialist service.
yeah,
Right? Until we can build up um, the patient's base and the awareness of the hospital, then we can get have these things going. Um, so with so in Ghana, well, not just Ghana, but in Africa, roads is an issue. Bad roads is an issue.
access.
So,
Yeah,
sir,
access.
yes, yes. I mean, the roads are always bad. So, I have been in communication with the local MP and assemblyman, and we've finally got the approval for to fix the road that leads to the hospital.
Excellent.
Yeah. And another achievement that we have is that with the NHIS, which is National Health Service in Ghana, some people, in that area in villages, they don't have the means um to pay for hospital care. And they might not have the means, they might not um to pay for the care for transport to get to the hospital. So what they would do, they would self-medicate.
Yeah,
Yeah. So what we've done, we've kind of partnered with the National Health Service. So anyone that comes through the hospital, they there's normally a fee, a registration fee,
mm,
and an annual fee. So once they come through us, then that fee will be waived.
good.
So we want to get people who don't have access to the hospital by any not by any means, and making it easier for them
Mm,
to access the hospital.
yeah,
So whereas fixing the roads and making paying for hospital care much easier. So that's a stress that's off of their back.
yeah.
Yeah.
That's very good. And also potentially um, you can develop, or maybe in the future develop relationships with other international organizations who can support your work as well, what you intend
Yes,
to do.
absolutely.
There, various different specialist skills.
Yes, yes, yes. Definitely. I mean, I would like to see um I would like the opportunity to invite doctors from the UK um to come and volunteer or
Yeah,
training or something like that um in the hospital, because we do have the facilities for that.
excellent. And
Yeah.
we're certainly um, would support that and help facilitate that because I think what it will do, it will provide the capacity building support for the hospital, but also it helps to reduce the inequalities as well
Mhm.
in terms of local access, but also for professionals, whether they're in the UK, USA, or in the Caribbean, to really get those skills as well and develop those skills on the ground with communities and actually helping to develop a health institution, which is really important. And
Yes, yes.
particularly those maybe who are also maybe at PhD level, are studying hospital systems themselves. And these days, it's the hospital is important, but also your local community is, the broader public health agenda. So I think with you um, encouraging that kind of collaboration, it also fits with the Sustainable Development Goals number 17, which is about global partnerships for development. So health is an integral part of that. So Who knows? There
Perhaps,
could be a link with Montserrat as well.
yes, perhaps you can give me the guidance and
Yeah,
steer me in the right direction and where
yeah,
we can kind of raise that awareness and get that, that dialogue
absolutely.
happening. Yeah.
Yeah, absolutely. So, Kevel, tell us, why did you choose Hobo as a location?
So um my my wife and I, we have um quite a bit of land in the area.
Okay,
And while we were there, um we spoke to some of the local people there, and that's what they've always complained about.
no
They've
hospital.
always complained about no hospital
Mm,
in the area. Like I said earlier, they do have a government clinic,
mhm.
but you know, everything is is not up to date.
Yeah,
They barely have proper lighting. The the walls it looks like it's the roof look like it's
the,
caving in and
the
things like that. It doesn't
services
look
are
great.
limited, aren't they?
Services are limited, yes. So um my wife, she was a nurse in Ghana,
Hmm.
and I'm an occupational therapist.
Okay,
And so we just put our heads together and said, "Oh, why don't we open up a hospital?
yeah, great.
We own the land anyway, so let's just choose one of the lands um, and just open up the hospital there,
Yeah,
to help the community."
hmm.
And it's been good. People have been very happy about it,
Good.
very excited. I've had meetings with the chiefs and things like that, um, to
Yeah,
discuss the hospital and the future of the hospital and things like that, and how we can bring further investment into the community
yeah,
as well.
yeah. I mean,
Yeah,
that's really important because hospitals have their own ecosystem, and eventually, you you may be surprised all the small enterprises that will grow up around the hospital as well.
yes, yes, yes. We already have people setting up shop in front of.
Yeah, so it'd be good to encourage that because also they're the same people who will, of course, tell their families and friends to come to the hospital
Yes,
and
yes,
and also support the services of the hospital as well,
yeah.
which is
And you're right in saying the hospital has its own ecosystem because from when we started building the hospital, um, now you've seen a lot of homes being built. So
exactly.
there's a lot of development coming into the community as a result of that.
Yeah, yeah,
Yeah,
and uh, and hospitals in neighbourhoods. If you take the UK, there it's a good example. A hospital, a local hospital, is an important anchor in the community. The jobs,
absolutely.
skills, the volunteering opportunities, the maintenance, and all those sort of repairs and maintenance, all those kind of local um, enterprise opportunities are really important as well. So I think it's very well done. So what's your original connection with Ghana then?
My wife.
Because
My wife is
through your
Ghanaian, yeah.
wife, because your wife is Ghanaian. Okay,
My wife is Ghanaian, yeah.
okay,
Yeah.
okay. All right. Excellent. So just before we close, Kevel, if anybody's interested in just connecting with you and the hospital, they may have supplies to donate because we run a lot of programs for donations. Could you broadly just tell us uh, what type of supplies maybe would be of interest and how somebody would make connection would connect with to you?
Yes. So we are currently um so we have the main building, we have the apartments, and then we have currently building another structure at the back, and that will be the X-ray and
Mhm.
scanning. which is very important in a hospital, right? And there's none of that anywhere near to where the hospital is. So if we make a referral, the person has to travel far to get, x-rayed or scanned. So x-ray machine, scanning machine, lab equipments, um, and like I mentioned earlier about the surgical department,
Yeah.
we want to have some modern surgical equipments.
Hmm.
Um, like I mentioned with the auxiliary room as well, where I want to have people who are able to observe
Yeah.
the surgical procedure in another room as well. So while they can see it through the glass, to basically invite more students and give more students the opportunity to have that practical experience in their training. Um,
And actually, and as you say that, the hospital also uh, would be good for public health, so people could actually come to the hospital and get more information about health education, and
yes,
particularly, maternity services, women and girls, and long-term conditions. So again, that's the other advantage with the hospital. It's an important location for learning for local communities. And again, once again, providing opportunities for people who are studying global public health initiatives. And it's really important for them to uh, be on the ground and understand the daily realities of people's lives. And that can contribute into their research studies. So
yes,
it's a very
absolutely.
important system that you're putting in place there. So I certainly look forward to supporting your efforts.
Thank you. Thank you.
And people being able to make contact to you, how do they do that?
They can send an email to info@hoborcommunityhospital.com
Okay,
and I'll be able to respond to them there.
excellent. So thank you very much,
No problem.
and,
Thank you.
and very well done as a KPS protege.
Yes.
I should say KPS Montserrat protege.
APS Montserrat Protégé. Yes.
Yeah,
Yes.
the fact that you, particularly part of the Windrush generation, can leave the Caribbean, come to the UK, and then from the UK go to Ghana, have the vision, the determination and courage to build a hospital, that it really is commendable. So very well done.
Thank you. Thank you.